everybody, Happy New Year. It is January 1st, 2017, and I've been waiting a long time for this new dental procedure code to come out. There's been a lot of gray area when it comes to diagnosing and treating my patients, and as of January 1st today, there's a new procedure code that I just wanted to give everybody a heads up about, kind of explain the code and why it's here and how it will affect you. So I'm going to get right down to it and explain this procedure code for you. So the code is 4346, and here's how it reads. The removal of plaque, calculus, and stains from supra and subgingival tooth surfaces when there is generalized, moderate, or severe gingival inflammation in the absence of periodontitis. It is indicated for patients who have swollen, inflamed gingiva, generalized suprabony pockets, and moderate to severe bleeding upon probing. Should not be reported in conjunction with prophylaxis, which is cleaning, scaling and root planing, or debridement procedures. So just like always, whether you're a new patient in a dental office or you've been going there for years, it's important for you to know that when you see your dentist and you see your hygienist, we're putting you into a category based on the symptoms that we see and based on your habits at home. So we're either going to say that you're healthy or you're not healthy. But according to the insurance companies, we didn't have any codes for patients that were on their way to losing bone but hadn't gotten to that point yet. So for instance, if I have a patient that comes in and they've got a little bit of tartar and no bleeding, and it seems like it's going to be a fairly straightforward preventive appointment, then we're going to do a cleaning. It's a 1110 code, and that means that you're just getting your teeth clean. It's a preventive procedure. Everything is healthy up to this point. And then there was, on the other end of the spectrum, we had procedure codes for patients that have lost bone, that have been treated for that bone loss, or are being treated for that bone loss. So there was no way for us on paper to tell the insurance companies or everybody else within the office that we're doing a cleaning in the presence of gingivitis. They had no way of coding out for what a lot of times we'll say is a bloody prophy or a hard prophy. Like maybe there's a little more tartar, it's harder to get off, it takes more time, but there's infection. And I know a lot of you, you're in that category where maybe you don't floss your teeth at all, maybe you go to bed without brushing quite often, maybe you drink too much and that's kind of like a blood thinner, maybe you're taking medications that cause bleeding, maybe it's been 3 years since you've had your teeth cleaned. Whatever the case is, there hasn't been this black and white in our mind, but on paper there's been some black and white. You were either healthy or you had periodontal disease. So I'm excited to have this new code because it's going to better represent my patients that come in and are just not healthy. I want to prevent them from having bone loss, but I don't necessarily need to go into deep scalings, root planing, laser reduction. I don't need to send them to the periodontist yet because we haven't actually lost bone. I just want to get them back to being really healthy and getting a cleaning, a prophy. So this is a great code that's going to be better for patients, better for the doctors and hygienists, and better for the insurance companies. Let me explain why. So the reason this code is so beneficial to not only dental staff but to patients as well is because it's much more accurate for patients that fall into this category. In the past, there has been undercoding or under treatment planning, or overcoding or over treatment planning. And what I mean by that is if you fall into this category where you have gingivitis but you don't have periodontal disease as in bone loss, if you are in that middle ground, two things could happen. You could either get put into a healthy category on paper and get a cleaning, and the hygienist just does the best that she can, or you could possibly get into a situation where, because the full mouth probe showed pocketing in all of your molars, let's say if you had 4 or 5 millimeter pockets in all of your back teeth, it would be easy enough for a dental office to code out and treatment plan for 4 quadrants of root planing, 4 quadrants of scaling. There's a huge difference between just having a cleaning and having 4 quadrants of root planing, but this is what we've seen in the past. There's been a huge discrepancy between different caregivers. So we're hoping that this is going to bridge that gap. It's going to potentially save patients and insurance companies money by focusing on people that are on their way to losing bone. So a lot of my patients are going to have one question for me: how much is this going to cost? Okay, so there's no great answer for this because it depends on the insurance company you have, or if you're cash pay. It depends on the state that you live. It depends on if you're going to a network dentist or not. But the good thing is this gets everybody on the same page. It gets rid of that gray area that we had in the past, and it's also going to help motivate people to get to a healthier point. There's what I've read so far is that if you have this procedure done, you could come back in 6 weeks to have another cleaning done and an evaluation. You could come back, get yourself on a 3-4 month recall, come in to see the hygienist every 3-4 months, get rid of this infection, never have the bone loss, and go back to this 1110 code, which is actually potentially going to save your teeth and save you a lot of money. So hopefully a lot of you that are watching this, you'll never have to worry about it. I hope that you all just go in and see your hygienist twice a year, 3 times a year, whatever's a good schedule for you, and you never have to worry about this. But I just wanted to prepare everybody. Just like everything else, things change. It's going to take a little while for the insurance companies and for all the dental offices to get on board with this, but it's all for the good. Now, if you guys have any questions, please comment below, and I'll get back to you with another video as soon as I can. Thanks for watching.